Right. Well, the theme of our AGREC showcase today is adapting public health and science for Atlanta's global communities. And I hope you'll see across the course of the presentations how each of these projects really exemplifies those common themes, as well as the core AGREC components of multi-institutional, interdisciplinary work that is addressing a global issue, something that is global in scale, but that we can address here on the ground at the local level in Atlanta. And so I will start by inviting Dr. Sue Kasun and Zuri Espinosa. Sue Kasun is an associate professor of language and culture at GSU with a focus on transnationalism in her scholarship and an emerging interest in AI and education as a recently named International Society for Technology and Education AI Fellow. She has worked with partners in various communities throughout Mexico and published 2 books with Routledge related to her work there in the last 3 years. She's currently a specialty editor for the journal Frontiers, Language, Culture, and Diversity. Her colleague, Zuri Espinosa, is a clinical assistant professor of TESOL in the Department of Inclusive Education at Kennesaw State University. Her current teaching work encompasses supervising, mentoring, and teaching pre-service teachers within the MAT TESOL program. Her research work covers the reflective learning experiences of culturally and linguistically diverse Latina and Latino students in ESOL classroom settings and beyond. This year, she published a book chapter in Anti-Racist Research on K-12, Education and Teacher Preparation, published by Rauman and Littlefield. She's mentor program coordinator for Creciendo Juntas, for which she created a cross-generational mentorship curriculum that empowers young Latina girls with a focus on identity, literacy, art, mindfulness, and team and peer mentoring. And the floor is yours. One second, I may have it. Oh, no, that's correct.
Thank you so much. Can you hear it? Okay. Okay. Yes. What are we moving?
I'm moving this banner.
Oh, okay, great. Buenas tardes, ¿cómo estamos? También, gracias. We're pro-language people here, right? So let's use all of our resources. It's a pleasure to be here. Thank you so much to the Atlanta Global Studies Center and for each of you for spending this moment with us. We are presenting about our work on the grant this year. Our title is Indigenous Science for Spanish Dual Language Immersion. And Zuri, do you want to say hello?
Hola, un placer. It's a pleasure being here with Sue and collaborating with her all the way from Kennesaw. And Sue leading this project for us all is going to be very rewarding for all of us.
Okay, so we're going to buzz through our 10 minutes quickly, joyfully. We're going to explain what is this concept of native science, explain some work we've done in Atlanta Public Schools. Our guest folks from Mexico who just keynoted last month at KSU, thanks to Zuri's work. This summer, my son included, dual language kids in Atlanta Public Schools will be learning about Indigenous science. Thanks in part to this work. And a lot of this is really organic, so like so much of our good work, right? And it's through partnerships, longstanding through several years, including with APS. This summer, we'll do an upcoming workshop in Veracruz, Mexico, that we'll tell you about, and some more future plans. So the idea of native science is borrowing from lead scholar Gregory Cafete's notion, the interconnectedness of all creation, bridging traditional knowledge with modern education. And so these are teachers from a former project with my peers in Veracruz who are actually from New Mexico, and they're learning about natural dyes and medicinal plants at the Center for Indigenous Arts in Veracruz, which is where we'll be later on in this summer, thanks to the grant. So one big component is that, like I mentioned, this weaving in of dual language immersion. My son, by the way, doesn't really matter in this project, but there's over 60 dual language immersion programs where kids are learning half the day in a target language, most of them in Georgia and throughout the US are Spanish, and the other half of the day in English. It's one of the few points of hope on the landscape of public education, to be quite honest. So it's exciting to be able to be doing the hopeful and the generative. And our grant addresses what are referred to as pillars 3 and 4 of dual language education, which pillar 3 was kind of engaging cultures, which doesn't happen enough in dual language classrooms. It's so much about just perseverating on language and getting kids to be fluent in a target language. Pillar 4 is more recently published, this idea of criticality, of engaging ideological issues, engaging issues of equity, like our last panel, talking about the global south and how are we, engaging these kinds of issues. So dual language immersion also happens to be the best way for heritage speakers of Spanish in this case, to learn Spanish and English, and for more monolingual children in the US to perform academically as well. So we've had several successes. We got 2 emergency visas for our peers from Mexico. We're on my deck here. They stayed with me in my house. There's Zuri and my dog. And so we have a faculty member from Kennesaw, an additional Nihal Cote, and these amazing folks from Veracruz who are either Totonaco or they work heavily with Totonaco populations. So we've been connecting faculty from 4 institutions across 2 continents. While our guests were here for about 10 days in Atlanta, in addition to all the other formal things they did, they got to meet people from 30 countries who were on a Fulbright Award, which is another project that I happen to be working on, district language education leaders, and all of our proposed grant activities are in motion, which isn't always the case, but we're cooking with gas here. So Zuri?
Yeah, so we were able to host Omar, Sara, and Armando at the KSU TESOL conference that took place in March, just a couple weeks back. And the TESOL conference is all about bringing local teachers and national leaders, international ESOL professionals together to expose them to programs and pedagogies, right, for all English language learners. So at the conference, they presented their work with the Totonacan Indigenous community, which includes students from the University of Veracruz working from their communities, with their own people, wise men and women who are considered knowledgeable leaders in their community, and allowing them to decide and collaborate in whichever ways that they want to collaborate and how they want to show their knowledge and their ways of being and living, and how they want to demonstrate that knowledge as well, and giving voice to their practices and their communities. So in his presentation, Omar talked about aprendizajes bioculturales through a story of his people and their traditions. And the story that he shared is a very personal story. It's about the way of life, their way of life in the Totonacan community, titled The Man of the Red Corn and the Song of the Papan. And then in the story, he talks about the Totonacan community cosmovisiones, and beginning with the native birds called papanes, and how the current agricultural system have caused these native birds to die, and how this process of the community planting their native corn has changed, and moreover, not really to really help the community, in the sense that his story centers on the ways of being and knowing of the Totonacan people and their relationship with the land. So the bird called papanes being part of that cyclical cycle of their way of doing their agriculture has been altered and affected. And how it connects to this natural cycle of life, of how they make meaning through language with the world. And, it's very meaningful self-experience that he shared with us, and a lot of the teachers in attendance and leaders really appreciated his story from a different perspective versus what we normally hear, which is through a Western science lens, right? And Sara spoke on There you go. And Sarah spoke on an integrating project of video letters, video cartas, and she touched on self-representation, collective community. She touched on creation, recovery of wisdom from the Totonacan community, and dialogue knowledge and knowledge uses of technological resources and how the community can use these technological resources, right? Because it's how do we get this information, this knowledge out to the world? And then Armando spoke about a design educational intervention that included teaching learning activities that analyze that students involved with the University of Veracruz. They analyzed the organization of the Indigenous Arts Center and their work. And they, they studied the Totonacan biocultural elements, and they chose elements, and they were able to know it in its social, cultural, and scientific scope. And they, they created artistic products designed through a multidisciplinary collaborative team. So they worked to get in as a community, building relationships, not just to gain this knowledge from the community, but at the same time, you had Indigenous and non-Indigenous students collaborating with the community and gaining that knowledge from the elders. So you see reciprocity occurring. Their presentation was well received in Kennesaw. My own department chair continually asked me about the project and what we're doing next. So we're very excited, and Dr. Kasun did an excellent job hosting our friends in Mexico at her house, and she hosted a dinner as well. And we had district leader Dr. Margaret McKenzie there, as well as some professors, right, that took part in the APS training there. So we were already able to come together as a community in building this bridge. And it's, it's not just about the finances or these other external logistical things that we worry about, because we want it to go well, but we also focus on building relationships and how does it affect their community? And then what can we give back as well?
Okay, so briefly, we had a couple of afternoons with all of the dual language immersion teachers from Atlanta Public Schools that were invited. They went voluntarily. That was a condition of doing the work. We weren't going to force anybody to have to embrace this knowledge. You can see an image from one of the workshops. That's a ceremonial space with offerings that the people, teachers themselves, the vast majority were Latinx. And so we hybridized that, like thinking about the cycle of life with plants, with the cycle of life, including ceremony for Totonaco people. And our three guests from Mexico led, along with my support, these workshops. And I guess I just want to say very briefly, there were lots of tears and emotions. And it was a real honor to be able to be present for this work. And there was a lot of unlocking, because there's a lot of hidden identity happening in our schools. And finally, even if people were from Colombia or Costa Rica, they were able to feel seen and to acknowledge, who they were. So this is a short video that I'm not going to show you in the interest of time, but this part of our curricular material. We shared 4 curricular units. Well, maybe I'll just quickly show just a snippet, just 10 seconds, if I can get it to open here. So this is an artist. She was 23 at the time of the filming. It doesn't want to. Okay, never mind. We'll just go back to the presentation. Anyway, she's been commissioned by the Vatican to share her Totonaco art. And this is a typical scene of Totonaco village, and that's the El Señor del Monte, or the cuidador, but the being who takes care of the hillside and the land. We went into small groups and worked through the different curricular units. Whoa, and now I'm in someone else's presentation. Okay. It's just really rich. I mean, it was just such an honor. It didn't feel like any other PD that I've ever done before, professional development, right? They're going to be working this summer with the curricular materials that we built. They're hybridizing it also with Robin Wall Kimmerer's Braiding Sweetgrass. If you haven't read that book, I highly recommend that you write it down. Braiding Sweetgrass. She's Potawatomi, and she's a botanist who studies moss. And she writes about our interconnectivity. So you will love that book. And up next, these are Omar and Sara meeting with the director of the Center for Indigenous Arts. It's a UN recognized heritage site. That's the key ceremonial space where we will be this summer with our peers and a bunch of young people, Indigenous people who will have access to their birthright, which is deep knowledge led by the elders. All of this work has been blessed by elders. Thanks to AGREC, we will be building more curricular materials that we can then use in these native science units. So, Katsani, thank you. That's the Pinako. And that's our contact info. So thank you.
Next, I'd like to introduce Dr. Nafisa Mustafa, is a dedicated physician passionate about providing comprehensive care to patients in the field of internal medicine. Originally from Khartoum, Sudan, she graduated from National Ribat University School of Medicine with a bachelor degree of medicine and surgery. She worked as an assistant physician in upstate New York, then completed a geriatric research fellowship with Michigan State University. Currently, she's a diabetes program manager and an incoming PGY1 internal medicine resident.
Hello, everyone. Thank you for coming today, and I'm very grateful for this opportunity. My name is Dr. Nafisa Mustafa. So today I'll be talking about enhancing diabetes care in Clarkston refugee community. So Clarkston refugee community, it's a home for refugees since 1970s. It's the most diverse square in mile in America, and also they call it, I think, the Isles land of the South, which is basically because the close proximity to the Atlanta and as well as the convenient for the transportation. So Clarkston has diverse refugee population from various countries, and there are people from approximately 40 nationalities and 60 languages spoken there. So it's basically the largest refugee group that's the rest from Afghanistan, from Burma, Ethiopian, and also as well as the Sudanese. So review of the Clarkston refugee community health needs and centers. Recent community needs assessment highlighted the significant care gap within the community. So basically there's a lot of centers try to cover the gap between the healthcare and the financial or the uninsurance under insurance population. So 6 out of 10 respondents made that less than 30,000 a year, and there are about 10 have not seen a physician in the last year. There are about also 10 reported that they're not going to seek medical care because the fear of cost of care, which is that's considered a big challenge for the refugee community. So the challenges beyond the high rate of uninsurance or underinsurance, Clarkston residents face linguistic and cultural barriers assessing care. So that's basically one of the big challenges, the language, and also understanding the cultural background and sometimes the religious beliefs when it comes to care or deal with chronic condition like diabetes. So regarding the health centers, as I mentioned, there's multiple health centers try to help with providing free service. One of them, we have Grace Village Medical Centers, is one of the handful clinic in Clarkston providing care for those without insurance. So Grace Village is a medical clinic. It's a state of Georgia certified clinic operating under the oversight of the Georgia Volunteer Health Care Program. It provides free medical care to those in need in Clarkston. So it's a walk-in clinic for primary, chronic care, as well as women health service. It provides free medication, conduct basic laboratory tests that with no cost to the patient. So diabetes among patient Clarkston. So diabetes prevalence at the one of the health center Clarkston, the prevalence of uncontrolled diabetes, which is the hemoglobin A1C more than 9%. The hemoglobin A1C, basically, it's a blood test that we do in order to check for the control of the diabetes over the last 3 months. So among their nearly 400 patients with diabetes was 33%, and only 1/3 had A1C less than 7%. That is due to multiple factors, including that lack of diabetes self-management education that is culturally and linguistically tailored. So limited access to healthcare providers with specialized diabetes management knowledge, limited access also to medication. So tailored diabetes management, our goal is to empower individuals in Clarkston to effectively manage their diabetes and improve their overall health outcomes. So basically, when it comes to chronic condition like high blood pressure, diabetes, it's very important not just to treat the patient, it's very important to empower them, to educate them very well, to let them take control of their health by educating them, know their cultural backgrounds, know their the culture, also like when it comes to the diet, that's how they select or the choices in the future. So that's very important to improve the outcomes and also the well-being within the community. So introduction to our clinic. Our diabetes clinic established in June of last year at Grace Village Medical Center to address the needs for dedicated diabetes care, providing linguistically and culturally appropriate health information related to diabetes and access to diabetes educator. This comprehensive diabetes care visits include medication management, diabetes self-management education, as well as nutrition education. At the end of November, our clinic moved to Clarkston Community Hub. And we are so grateful for this opportunity because basically provide us with a bigger space and kind of also dealing or even collaborate with other organizations in order to support our patient. So our team, if you can see at the picture here, to the left, we'll start with Dr. Scott Keller. He's the director. He's a board certified family physician and director of Clarkston Clinic. Dr. Saria Hassan, she's also a physician and also the vice chair of research at the internal medicine department of Emory University, and also Dr. Amy Zidan, it's also an emergency physician at the Grady Hospital. Dr. Mary Helen, which is the deputy director of prevention research at Georgia State University. We have also one of our medical student, Fikriya, to the left, which is start with us from the beginning, and Miss Betty, which is the patient coordinator as at Grace Village Medical Clinic. So multidisciplinary, our team is a multidisciplinary team, including primary care provider with experience in diabetes management, certified diabetes educator, as well as the communication specialist and interpreters. That's part of our team, and myself as the program manager. So the clinic flow, that's the patient are referred to us, to our coordinator from the Grace Village Medical Clinic. And then we call the patient through interpreter and schedule an appointment with them. After that, we arrange in-person interpreter in order to help us during the day, the visit. Our day of the visit, that's the patient first have like, first we triage the patient, and then we have 20 to 30 minute consultation with the diabetes focused healthcare providers. And then patient receive glucometer, test strips, and automated blood pressure cuff in order to check their blood pressure as well as their blood sugar at home in order to bring the reading for us to go over the reading with them. And then the patient then undertake like 30 minutes of diabetes education with a certified diabetes educator, and that's it's a very important part of our clinic because most of our patients, they need interpreter service. So we intend to get interpreter from their culture, not just speaking the language, but also being there. So in order to know what's the kind of background, help them to get the right choices when it comes to the diet, because that's a very important factor when it comes to chronic care or for diabetes. Okay, so The total number of organized clinic, that's from the period between June of last year to April of this year, it's about 23 clinic. And the total number being seen in our clinic since the start are 41 patients. And 32 out of those 41 patients, they need assistance with the language. If I can go to the graph, to sake of time, we'll talk about only one, the patient, the one at the top left. So a patient with hemoglobin A1C, and as I mentioned earlier, it tells us how the patient control over their diabetes. So we have like our selection criteria for the patient has to be like diabetes, like poorly controlled. So for those, about 75% baseline that A1C, it's very high, more than 8. And then after the follow-up, which is basically after 3 months, they're cut down, like 15% of them, they become like 30% decrease in their A1C, that's a great improvement when it comes to diabetes. So program development started with funding from Georgia Center Diabetes Translation Research to tailor an evidence-based program for diabetes self-management to the refugee population. It started with the Burmese population at the beginning. Since then, there's series of meetings held to tailor program to Burmese and Korean currently speaking communities. Implementation plan that is training more Burmese speaking facilitators for workshop to take place in May, which is that's our plan to start this workshop in summer of 2024. That's a very important to train from the same population in order to teach them. So our goal is to expand, increase referral from other clinics because we have all the resources, but we have a limited number of patients. Introduce point of care hemoglobin A1C, which is a small machine, so we don't need to send the patient to the lab to do that we can do it at the clinic, and partner with local organization to address food insecurity, dental care, and mental health need, which is very important, when it comes to the mental health, in order to care for the patient, in order to be adhered with the medication, and also with the diet and exercise. So the challenge that we face is access to healthcare, the socioeconomic factors, and
communities, and we want to do this through culturally tailored training programs. And so first I'll talk about our team. Our research project is known as the WERA project, which stands for Wellness, Ethiopian and Eritrean Youth Exploring Resilience and Awareness. And our team is made up of different professionals from Emory and Georgia State, and they also represent the communities that we're trying to work with. And I'll be presenting on behalf of our principal investigators, specifically Dr. Ramisetty-Mikler. So first, I'll touch on some background on why we're doing this project and its importance. And so a big part of that is there's over 23,000 individuals in Atlanta that are Ethiopian or Eritrean. And these communities face unique challenges and specific different types of resilience that we feel is important when we are trying to focus any sort of training for them. And through our research, we have found that there has been a lack of official statistics about mental health in this community, and that is part of what we are trying to tackle. And so our goal with this project is awareness, but we started this out with conducting a pilot or preliminary study where we tried to analyze the community's experiences and see what their specific challenges are that we could then focus on. So our preliminary research showed that mental health is a major problem for local Ethiopian adolescents and young adults. But there were no mental health awareness resources geared towards this specific community that was facing it. And some of the data from our preliminary research showed that there was a high prevalence of depression, where around 48% of individuals in our study fall under sub-threshold depressive symptoms under that category, which indicated that they still felt they had increased feelings of depression. We also saw a prevalence of anxiety in the community, though it was at a decreased level than their depression, it was still something that they were experiencing. And this was just the community that felt comfortable sharing that information with us, and isn't even depictive of how big this issue is. And so furthermore, some of our preliminary research findings showed that some common threats to mental health and emotional well-being for Ethiopian adolescents and young adults were stresses of familial educational expectations, their struggles with managing their multiple identities as an Ethiopian, as an American, and as someone who's also Black. And also another threat that they faced was coping with racism and discrimination. And another experience was dealing with stigmatizing community attitudes towards mental health service use, as several of the people in our preliminary research study indicated that they felt like they couldn't talk about it with their family members or even community members. And we also identified the need for increased awareness and education around mental health issues in these communities so that people could feel comfortable discussing it, and also if they do need help, can ask for those resources without feeling any stigma. And so our project aims were to develop culturally tailored educational materials that were designed to improve mental health awareness for Ethiopian and Eritrean communities in Atlanta. Our second aim was to then increase mental health awareness through those resources and training programs that we would provide. And another way we'll be doing this is by creating an essential group of mental health champions who are trained individuals who can then disseminate our mental health awareness campaign after the end of the project. Because we did find that those who are like deeper in the community can spread the information and the trainings more than we can. And so we'll be having 3 stages in our project. The initial stage was an intervention development, and then intervention delivery and data synthesis, which I'll expand upon. So we're currently at the end of our intervention development stage and starting our intervention delivery. And so we have conducted an exhaustive research review of existing research, our preliminary research, and those conducted at different institutions and throughout the US. And we have reviewed relevant mental health awareness training and resources that we have then compiled as a collection of mental health resources that can help this community. And we have are in the end process of designing our training workshop and how we would then evaluate how that training is working. We will be starting our mental health awareness training workshops in the different Ethiopian and Eritrean community centers within the next month. And we will be conducting 3 of those workshops to train our mental health champions that will be representative of the community. And so our next step after that will be analyzing our pre and post workshop survey data to see how their mental health awareness has improved over the course of the training, and measure the success of this project in improvements in mental health awareness, mental health resource use and interest in that use, as well as an ability to discuss mental health issues openly with other people. And we hope to also expand upon this data and report it out so that it can be expanded and used in different communities as well. And so the community engagement part of our project includes a youth advisory board, which was made up of people from the Ethiopian and Eritrean communities in Atlanta, so we could get their feedback at each step of the process. So when we were creating the mental health awareness resources, when we were making the training workshop, designing that, they were able to give feedback and give us a perspective of how they would see this, how this would work for them, or how it could be perceived by members of the community. We are also working closely with the Ethiopian Community Association in Atlanta and the Eritrean American Community Association of Georgia, which have also been a big part of the project and will be giving us the resources to host all our events in all our workshops at their community centers. So it's already a space that the community feels comfortable in. And so we also want to make this project sustainable. And so we are making sure that all our trainings and workshops and resources will be freely available to the community so that our mental health champions can continue to spread that. Anyone who hears about it, or even the community associations and centers, can have that available on their different sites, and so that it can continue to impact the community even after the end of the project. And we also plan on working with the Carter Center and their mental health program to spread this outside of just the Atlanta region. And if you have any more questions, you can also reach out to our principal investigator, whose email is here. And thank you for taking the time to hear about it.